So good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health and also the University of Oklahoma's Chief COVID Officer. Today I'm going to give a brief overview of where we're at in Oklahoma with respect to the pandemic, but I want to get across one important message today, and that is that cases are going up in Oklahoma. They've gone up actually substantially over the past 3 weeks. I want to highlight that because I don't think I'm hearing enough about the fairly substantial rise in cases in Oklahoma. So let me just go through. I've sent out a handout that provides information about current cases in Oklahoma. Right now, if you look at national data, Missouri has the highest rate of new cases in the nation. In fact, Missouri has seen the highest rate of cases in the nation and the highest growth of new cases in the nation. Oklahoma, in terms of rate of growth of new cases over the past week, has been second in the nation in terms of new cases. Today, the state health department reported numbers: 456,000 Oklahomans have had COVID-19. Additional deaths were reported today, and we're up to 8,587 deaths. I think most significantly, I want to talk about the increasing number of new cases on a daily basis. So as of today, the 7-day rolling average, that averages out new cases over the past week, is up to 190 new cases a day. I just want to highlight, on the next graphic that I sent out, I highlight that on June 7th, we were at 99 cases per day in the state. Now we're at 190. So simple math, we've seen a 90% increase in the number of new cases per day. Now, to put that in perspective, we were down below 100. So the number is still relatively small, but I think the rising trend of new cases is concerning. The other thing is it's not consistent across the entire state. In fact, central Oklahoma seems to be relatively spared at the moment, where cases aren't going up particularly rapidly. If you look at county level data, Ottawa County, which is far up in northeast Oklahoma, has the highest rate of new cases per day around the city of Miami and others. Craig County is also quite high, also up in northeast Oklahoma. And then the other county that has a relatively high rate currently is Comanche County, down around Lawton. If you just look at the sheer number of new cases per day, of course, we always expect our metropolitan areas to have the most. But interestingly, Tulsa, of course, had 259. Tulsa County's population is less than Oklahoma County. Oklahoma County only had 85 cases in the past week. Tulsa County had 259. So one of the themes that I'm going to highlight is that we're seeing a real rise in cases, particularly in northeast Oklahoma. I think Tulsa's become a part of that also. Tulsa County is currently at 8 cases per 100,000 population per day, but if you look at Oklahoma County, we're at only 2 cases per 100,000 per day. So there is definitely substantial variation between counties right now in the number of new cases. Hospitalizations remain stable. We've been seeing anywhere from 110 to 120 patients a day in the hospital. However, I'm concerned that we need to watch that number carefully, because as we see more cases, I would expect that hospitalizations may go up, but there'll be a delay between new cases and hospitalizations. So over the next couple of weeks, we need to watch that quite carefully. So that's where we're at in the state right now. Substantial increase in cases, up to 90% increase in the number of cases since June 7th. So speculating, why are we seeing such a rise in cases? Well, a couple of things, and I provided some information that I think will help support my contention here, and that is first that we're surrounded by states where cases are much higher, particularly we're very close to Missouri. I already mentioned that Missouri has the highest rate of new cases per day, but if you look at one of the graphics I provided, looking at county level data for Missouri, the real hot spot in Missouri is southwest Missouri, around the communities of Springfield and Joplin, where case counts are very, very high, and where they've done plenty of genomic sequencing to show that it is the Delta variant that is spreading in that portion of the state of Missouri. And of course, it's just a turnpike drive away, just down I-44 out of Springfield or Joplin into Oklahoma. Secondly, if you look in Oklahoma, the big increase in cases is in the northeast part of the state. We're also seeing some increase in the Lawton area. So I think when you look, Missouri has very high rates of COVID-19. Arkansas has high rates. We also see relatively high rates in both Colorado and New Mexico. So we're surrounded by areas where there's been growth of new cases. Missouri now leads the nation with the highest rate of new COVID-19 cases in the United States. But also, if you look at the parts of Missouri that are seeing this huge increase, it's parts of Missouri where vaccination rates are very low. And that's similar to what we have in Oklahoma. So when I looked at the most recent data from the CDC, and I checked it this morning, in Oklahoma, only 53% of Oklahomans have had at least one dose of the COVID vaccine, and only 44% have had both doses. So just about half of Oklahomans have not been vaccinated yet against COVID-19. So we have a substantial opportunity for improvement in terms of vaccination, but I also think we have a substantial opportunity for increased cases and spread of the disease because we have a large population of people in our state who are not vaccinated. So let's talk about the variants. I'm going to suggest that the outbreak of the Delta variant in southwest Missouri is probably driving a lot of the increase in cases that we're seeing in northeast Oklahoma. And we're not doing a lot of variant testing in Oklahoma right now. The state health department yesterday in the weekly epidemiologic report reported 41 cases that have been confirmed of the Delta variant, but I'm betting that there are many, many more cases in Oklahoma right now. And so the UK variant, the Alpha variant, had been the predominant strain in Oklahoma, but now I think it is the Delta variant. So what do we know about the Delta variant? Well, Anthony Fauci this week announced that Delta variant accounts for more than 20% of all new cases of COVID-19 in the United States. And again, think about what happened in India. It spread like wildfire through the population of India, resulted in many, many hospitalizations and deaths. We know that the variant is 50 to 60% more transmissible. In other words, it spreads easier from one person to another. So it spreads easily. We also, at least the preliminary data suggests that patients who get infected with the Delta variant actually are sicker, more likely to have complications, more likely to end up in the hospital. So in the studies that are published, they've suggested that it doubles the risk of being in a hospital. The vaccine, good news is, the vaccines that we have in the United States do work against the Delta variant. However, not quite as well. So if you've only had one dose of one of the mRNA vaccines, Pfizer or Moderna, the vaccine, that one dose is only about 33% effective at preventing infection with the Delta variant. If you've had both doses, it's about 88% effective at the prevention of infection with Delta variant. The other good news is if you're fully vaccinated, even if you have a breakthrough infection with the Delta variant, you are much less likely to be hospitalized and you are much less likely to spread the virus to somebody else. So again, strong reason that we need to continue to do everything that we can to promote vaccine in Oklahoma. One of the questions I get often is, we know a lot of Oklahomans got COVID-19. So they have some degree of natural immunity, and I want to make it clear that natural immunity does appear to prevent some COVID infections. We just don't know how well. We don't know how well natural immunity from an infection with COVID-19 from the original Wuhan variant would actually protect you from being infected against the Delta variant. So we will see some breakthrough infections for sure, and I just don't know. I can't tell you. I haven't found good data to tell me how good natural immunity might be against the Delta variant. But again, just about half of Oklahomans are not vaccinated against COVID-19. So I just put in a couple of quotes. One was Fauci this past week when he basically said that Delta virus, or the Delta variant, is our country's greatest threat in its fight against coronavirus. But one that really caught my attention was an article that was in the Joplin Globe, Joplin just up the road from northeast Oklahoma, and they stated it was like deja vu. Local hospitals seeing COVID-19 numbers trending towards the winter peak that they saw just a few months ago. So Southwest Missouri is really getting hit hard with COVID-19, with lots of hospitalizations, ICUs filling up again, and I think that Delta virus that's causing the big outbreak in Southwest Missouri is making its way down the turnpike. And as I pointed out in a press conference this week, you just think about it. Somebody could be driving through Missouri, stop, eat at a truck stop or at a McDonald's or any restaurant, stop any place where they're around other people, and then drive on into Oklahoma. State lines, international lines do not stop the spread of COVID-19. So that's the key point I wanted to make today, is that we've seen a substantial increase in cases. I did want to highlight just a couple of other things that have been in the news this week. The first is the ACIP yesterday during their meeting had comments about myocarditis, that inflammation of the heart that can occur after people get the Pfizer or Moderna vaccine. And some patients will get something called pericarditis. The pericardium is the lining around the heart, and sometimes it can get infected also. So there was good news, though, in the ACIP report. And when you look at it, the stuff that was reported, they said out of 300 million doses of the COVID vaccine, they had identified 323 patients that met their case definition of heart inflammation. So very, very rare, very rare. And the other piece of good news from their report was that most of those people recovered quite quickly, usually within a week or so. Some of them ended up in the hospital, but for very short periods of time. Remember, the treatment for myocarditis, this inflammation of the heart, is a condition that we see just from other viral infections. It doesn't occur just because of vaccines. We see far more cases from viral infections, and you just treat it with non-steroidal medications like ibuprofen and rest. So good news from CDC that yes, it appears that it can happen, particularly in younger people. It seems to have a predilection towards male patients, but it's very rare, and most people recover very quickly when it does happen. The second thing is just kind of a follow-up from something I talked about a number of weeks ago, and that is how good are these vaccines in people who are immunosuppressed? And the one population we talked about were people who have had organ transplants, because patients who have organ transplants have to take potent immune suppressive drugs to keep their immune system from attacking their new organ. So the studies that have been published in Johns Hopkins showed that only about 60% of the people after 2 doses of the vaccine actually saw antibodies when they got the COVID vaccine. The good news is a very small paper published in the New England Journal of Medicine this week showed that if you give a 3rd dose of the vaccine to some of these organ transplant patients, they actually did develop antibodies and had a better response. There is no formal recommendation for more than 2 doses of the COVID vaccines at this point, but I think that we will identify some populations where a 3rd dose may make sense, and organ transplants where you're highly immunosuppressed may actually make sense. And then the last one that I'm going to mention from the news this week, which I found to be just a fascinating study, 2.9 million families in the United States that had private insurance. The study came from the Rand Corporation, and they looked at if somebody had a birthday, did that increase the incidence of COVID-19? So making the assumption that if somebody had a birthday, they might have a party where they get people together. And what they showed in this particular study was that small and informal social gatherings, such as birthdays, in particular children's birthdays, they did not see this effect very much for adults, because most adults probably don't get a bunch of people together routinely for a birthday. But for children, it seemed to increase the risk of COVID infection fairly substantially. So if you looked, if the family lived in a community where there was lots of COVID, it increased the number of COVID diagnoses by 30% within the next 2 weeks. So again, they just use these large administrative databases to show that if you're getting people together, particularly around kids' birthdays, you may increase the risk of transmission of COVID-19. We know the Delta virus variant of the virus does spread easily amongst children. So those are the key points I wanted to make this week. Again, I really wanted to press to make sure that we talked about the substantial increase in the number of cases in Oklahoma, 90% increase in the number of new cases per day since June 7th.
Okay, you covered a lot of the questions we've received today, so I'm going to try not to be redundant, but some of them are kind of extensions of that. So one of them is, when it comes to the variants, how would natural immunity compare to protection versus a vaccine? How do they compare?
Yeah, so the question is, does natural immunity essentially give you protection against some of the variant infections? And for that, I simply have to say I don't know. I did a literature search this morning to look to see about the impact of natural immunity. That is, somebody who previously had COVID, we know that they develop some degree of immunity from repeat COVID infections. But what we don't have is good data about whether that protects them from infections with the variants. So I saw some small suggestions that the Delta virus may still occur in people who have previously had COVID, but we know that the Delta virus can cause infection in people who've previously had vaccine too. So I just don't have good data to be able to compare the protection you get from one of the variant strains of the virus from natural immunity versus vaccine.
So I don't think we have the numbers specific to this, but do you know how prominent Delta variant is in Oklahoma?
Yeah, so the question is, do we know how prominent Delta variant is in Oklahoma? We don't at this point. Again, in the weekly epidemiologic report that was published by the State Health Department yesterday, they had identified 41 cases, but I think many of you know that Oklahoma ranks very, very low in terms of the number of viruses that are actually having genomic sequencing. We're not testing very much, so I don't think we know what that proportion is. Nationally, Fauci basically stated that it's more than 20% of all new infections. I had a brief conversation yesterday with Dr. Bradley Stevenson at the University of Oklahoma around the wastewater testing that we've been doing. They're seeing definite spikes in northeast Oklahoma, particularly in Tulsa, where they're doing testing, and they're in the process of doing sequencing on those identified wastewater samples to see if they've changed. Before it was the UK variant or the Alpha variant, and I think all of us are not going to be surprised if it's the Delta variant and it's coming down the turnpike.
On the sequencing, the genomic sequencing, this reporter at Tulsa World says that Oklahoma ranks last for genomic sequencing of COVID, and wondered what your thoughts, if we should or shouldn't be concerned by that, given the Delta variant and other variables.
Yeah, so the question is, the statement is Oklahoma ranks last in the terms of the proportion of samples that are having genomic sequencing run. And I don't know the status of the public health laboratory. I know they bought the equipment. They have the equipment to do it, but it's one thing to have equipment. It's another to have enough personnel or trained personnel to run the equipment to do the genomic sequencing. So I just don't know where the state is at with respect to their capability or capacity to do additional testing. It does concern me that I think we need to do more genomic sequencing because I think it's very, very important to be able to identify where we have potential areas of outbreaks. What I really think is going to happen is we will see clusters of outbreaks. We will see outbreaks amongst groups of people who are unvaccinated, and the Delta variant spreads very rapidly in those groups.
Okay. the symptoms any different?
Yeah, so it's a great question about the Delta variant. What are the symptoms if you get that infection? And it does turn out that there are some differences from the symptoms that you get with the original wild type or Wuhan strain of the virus or the Alpha variant, the UK variant. So we remember all the classic symptoms of COVID: cough, fever, loss of taste and smell, and then a host of other symptoms. It turns out with the Delta variant, the most common symptom is headache, followed by fever, and some people will develop other symptoms with the Delta variant. But headache is number one, runny nose is common, and fever. So the symptoms are a bit different. So if you have an unrelenting headache, runny nose, if you're running a fever, think about the possibility of COVID infection with the Delta variant.
So the first two things there are pretty common this time of year, spring, allergy season.
Yeah, allergies don't typically cause fever, though. So if you have fever in particular, and headache, runny nose, those types of symptoms, certainly think about the possibility of COVID infection.
So getting vaccinated, does it help slow the spread of the Delta variant, or does it just help us individually be not as affected?
Yeah, so it's a great question. If you're fully vaccinated and you happen to be exposed to the Delta virus, Delta variant of the virus, does it protect just you, or does it help you slow spread? So there's good news on both fronts. It protects you even if you happen to get infected. Even if you happen to get infected, you're much less likely to have complications or to end up in the hospital. But there's also data that suggests that fully vaccinated people are much less likely to spread the virus if they're infected with the Delta variant. So not only does it protect you, but it also protects the people around you. So again, a strong reason to go get vaccinated.
So I would think there's some hearsay to that. I mean, you're saying if a person that gets vaccinated is probably also more careful, and so maybe that's the reason they're not spreading. I mean,
Yeah,
right?
So April's asking whether there's some bias in that data that people who've been fully vaccinated might be more careful. A lot of people remember that get COVID-19, never have symptoms or have such minimal symptoms, they never get a test done. So they may not even know they're infected. The good news out of the UK is that if you're fully vaccinated, you're less likely to spread the Delta variant.
And let's see, I think we've already talked about this, I'm sorry. Could there be a rollback in COVID mitigations if the variant spreads? I don't know what that means.
Well, so I think the question is, could we see some change to requirements for mitigation strategies if we see further spread of the Delta variant? Remember, by far, the most effective of mitigation strategies is to get the vaccine. So I encourage everybody to get your kids vaccinated if they're 12 or older, adolescents. They need to be vaccinated. They're the people who can get this infection and spread it. So promoting vaccines most important. Masks are universally effective against all variants. So it doesn't matter which variant we're talking about. Mask will help you keep you from getting infected and keep you from spreading the infection to somebody else. So right now, I think it's possible if we saw a big outbreak in Oklahoma with hospitals starting to fill up again, perhaps some emergency order might require some change in mitigation strategies. But right now, overall, case counts are low. It's right now seems to be limited to a couple of areas of the state where we're seeing the most cases. And so I don't anticipate any big changes, but I think all of us need to be prudent and careful. And if we see outbreaks, there's nothing that keeps you from wearing a mask if you're in public.
So kind of an extension on that, ARMG was asking how confident are you that the state has its eye on the ball in regard to the Delta variant and a possible resurgence? So are we ready for that contingency?
Well, so the question is, about my confidence in whether the state, I can't comment. I suspect they're the ones who publish the data that I use to create these graphics and other things. So I know they know that the case counts are going up. And they probably have a lot more data about where those cases are actually occurring at, things like that. I think it's important that all of us watch the data, watch what's happening in our local communities. If we start to see hospitalizations go up, if we start seeing a lot more cases, then maybe it's time to think about going back to some of the things we did through the fall and winter months to slow the spread of the disease, like wearing masks, trying to limit indoor activities. Outdoor activities generally are going to be pretty safe.
Have we seen any hospital, are the hospitals at all in standby mode across the state? Or
Well, I think, yeah, so the question is, are hospitals in standby mode? I think every hospital in the state is still in somewhat of shell shock from what happened through the fall and winter. So I think every hospital in Oklahoma is prepared to go back. I think we know a lot more about treatment of COVID-19 when those patients come into the hospital. We have drugs that we can use to treat it. We have a better idea about how to ventilate patients and other things if they get that sick. So the good news is I think mortality rates would be much lower if we do see some outbreak, but absolutely every hospital in the state is watching it, is concerned right now. As I mentioned, in Oklahoma City, we haven't seen any big outbreak in Oklahoma City, but I'm fairly confident that we will see variant strains continue to march down I-44 right into Oklahoma City, across the state, down I-35, and we'll see spread of the virus.
You talked about the third the possibility or how valuable maybe getting a third vaccine or booster would be. So if you could just to answer this question from K4, just kind of go a little bit more into that. If you advise against or for getting a booster shot for those who are concerned about maintaining immunity?
Yeah, so the question is, should somebody go out and seek a booster dose of the vaccine right now if they're concerned about maintaining immunity? There just is no published literature at this point that shows that that will be beneficial. We don't yet know fully how long immunity from your first dose of the vaccine will last. The one population I mentioned were people who have had organ transplants, who are taking potent immunosuppressive drugs where a third dose may actually boost their immune system even a bit more and get better antibody response. But short of that population, it's the only study I've seen that have looked carefully at whether a third dose would be effective or not. So currently, the other point I want to make is just because the antibodies in your blood go down doesn't mean you've lost immunity. Because remember, there's a second immune system, the T cell system, harder to measure, but is the immune system's long-term memory. So just because you don't have antibodies or antibody levels fall off doesn't mean you're not immune anymore.
A couple that are just coming in. This one, since we were talking about Tulsa earlier, according to the state epidemiology report, Tulsa has a 3-day average of 55 hospitalizations, 30 higher than the second closest, which is Oklahoma City. How worried should Tulsans be?
Well, so clearly Northeast Oklahoma seems to have a lot more cases. So when you look at hospitalization, remember you always have to take into account the population of people that live in that area. But if I stratify new cases based on population incidence, Tulsa County is seeing about 4 times more new cases per day than Oklahoma County, which has a bigger population. So when I adjust for a population, Tulsa County is seeing about 4 times more new cases per day than Oklahoma County. So yeah, I think there should be concern in all of Northeast Oklahoma where there seems to be increasing spread of the virus.
Associated Press was asking, why is Oklahoma not testing more for the Delta variant and other variants? And I know you talked about that a little bit.
Yeah, again, I can't speak for the health department. I don't know. I thought I'd heard this past week that they were getting ready to ramp up. I know that when they moved to the PHL lab in Stillwater, they acquired the equipment to do genomic sequencing. I don't know if they have all the technicians, supplies, and the other things that they may need to actually do that. So,
A couple questions came in through the live chat, so I just now got those. From the OU Daily, I haven't had a chance to review them. What are suggestions for immunocompromised professors, students as they enter campus during the fall?
well, by far. So the question is about when we return to school, if somebody's immunocompromised, students, professors, staff, or others of universities, K through 12 schools, and others. Again, the most important mitigation strategies make sure that as many people as possible are vaccinated. Vaccines will reduce your chance of being infected substantially. Even the most immunosuppressed get some protection from vaccines, so that's the first and most important. Second, if you're not comfortable in any way, wear a mask, because wearing a mask has clearly been shown to reduce person-to-person transmission of COVID-19. So we will encourage people who have any concerns, anybody who's unvaccinated, we will strongly encourage them to wear a mask to reduce the spread of COVID-19. And then, almost all schools will have some special accommodations for people who have very special circumstances, disabilities, or others, and those always you need to work with your individual school through the disability program or other mechanisms for mitigation.
Another question that came in through there was just asking about saying the State Department has asked, Health Department has asked labs to start sending PCR plus tests to PHL now for variant sequencing. Do you know if it's feasible for that to happen, and how important is the variant information now for Oklahoma? So, just to go wrap with this.
Yeah, so the question is about that I thought I'd heard that the State Health Department had requested laboratories to start submitting positive PCR tests for genomic sequencing. I know they have the equipment. Dr. Michael Kaiser, who was the lab director at the PHL lab, highlighted that they have the capacity on the equipment that they have to do a lot of genomic sequencing. So I think it's important. I think it's important for us to know what's spreading in the state, but I think they have the equipment to do so.
No more questions.
All right. Again, just wanted to strongly highlight one more time the importance of recognizing that case counts have gone up substantially, 90% since June 7th, and we need to keep our guard up. This isn't completely over yet.